Welcome to Cut the COVID Crap Part 34. The death rates in Australia and New Zealand increased by more than 5% in 2021. That's without there being COVID, because it only started at the end of 2021 in those countries. Normally, I start with the UK health statistics data, but they don't update the statistics anymore, dependent on vaccination status. They don't want to show that apparently. I mean, it's clear that the people, the unvaccinated people, are around the like 10% or lower mark for new infections and hospitalizations and deaths, despite them being a larger proportion. Um, uh, Despite, I don't know, 20 to 30% of the population not being vaccinated. Anyway, they don't show it anymore. Too bad. So I'm not going to discuss those data. What I do want to discuss today is the death rates in over 2021 in New Zealand and Australia, and actually also compare them to South Africa. I did previous videos about specifically West Australia before, because especially West Australia was in a unique situation that there were for sure zero COVID deaths in 2021, and so the excess deaths in West Australia, about 6% in 2021 compared to 2020. Where does it come from? Well, one thing we know for sure, not from COVID deaths. And in 2021, the vast majority of the population got vaccinated. They really pushed it a lot in Australia. So 6% increase in deaths, that's significant. I'm not saying it's a lot in absolute numbers, but it's significant. I mean, it's not random. It's not like it's not that from one year to the next randomly 5% more people die. And in I'll compare it to the numbers in New Zealand later on, but it's 7% there. Anyway, so yeah, I discussed West Australia before. So no natural disasters, no flu epidemic, but like more than 90% of the population, 95% of the population being vaccinated, adult population at least. Anyway, uh, recently the data for the rest of Australia were published by the Australian Bureau of Statistics. The link below. If you open that link, you'll see the first graph that you can scroll down to. Clearly shows it. The red line is the 2021 deaths, and it's almost the whole year. It's significantly above the 2015 to 2019 range, and also above the 2020 range. Again, so also for the whole of Australia, they say 5% more deaths than in 2020. So it's in every state, I guess. So unfortunately, what I find unfortunate, because it's like my opinion when I see this, it's significant, but it's not the end of the world. I mean, we'll compare to New Zealand data later on again. Still significantly more births than deaths. So, but to say that it's random, or that we can, I mean, to not admit that vaccination have an influence, yeah, that is nonsense. I mean, 95% of the whole population gets vaccinated. Myocarditis is a known side effect, and amongst many other ones. And again, it's not in a large proportion of the population, but there are known side effects. There is a 5% increase in death rates. Yeah, you could still justify vaccinations because, like, in it's still that everybody dies. It's still a small percentage. Um, I mean, if every year one 1% of the population would die roughly, then now it's 1.05% of the population. I mean, it's a small increase. It's not like that it's going to be the end of humanity. But to deny that vaccinations play a role here is being in denial, basically. Um, Given the the side effects that are reported, and they are underreported, of course, it makes sense that there's some influence. So anyway, look at the graph: 5% increase, and again, COVID only started in December 2021 in any earnest in any part of Australia, mainly in the East Coast. Other link below is from New Zealand. They published the data as well last in February by now. There you'll see that if you scroll down a little bit, 58,000 live births in 2021 and 20 and 34,000 something deaths in 2021. So 58k more births, 34k deaths. So a net increase of roughly 23k in people. However, the deaths is 2,319 more than in 2020. 2,319 over roughly 32k. That's a 7% increase. New Zealand was in the same situation. Hardly any COVID, so number of COVID deaths in 2021 is zero or extremely close to zero, but 7% increase in death rate. That is significant. That doesn't happen randomly, not at all. But again, to put it in perspective, you would have, so let's say roughly 58k births, and now we have roughly, instead of the expected 32k deaths, we got 34k deaths. Still a net increase of population, um, which you can like or not like. You can be eugenetic about it, if that's a word or not, but at least it's not the end of humanity or something. But to say that it's random and it's again not related to vaccination, yeah, that is strange too. There are known side effects, yeah, there's an impact on death rates as well. I mean, you interfere with your immune system, yeah, that sometimes goes wrong, especially if you don't aspirate. But I also like to put it in perspective. I always like to look for the counter cases, counter arguments. So I put a link of the South African link below, uh, Statistics Bureau, Stats SA. Um, there you'll see, and yeah, South Africa had a vaccination rate of pretty low, around the 30% mark uh, so far. So way lower than Australia and New Zealand. And there, in the headlines, you'll see that in South Africa, the this resulted in a significant increase in the accrued death rate from 8.7 deaths per thousand people in 2020 to 11.6 deaths per thousand people in 2021. So that's an increase of 34%. So I find that interesting. Whereas in Australia and New Zealand you can rule out COVID deaths, and yeah, you have to put forward um, vaccination. And yeah, and that's the thing in the ABS, in the Australian link that I sent. COVID is discussed at length, and maybe underreporting, da 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 da. But vaccination side effects, no mention at all. And that's the thing I have a problem with. Basically, admit that there's at least some. It's not large, but admit that there's at least some side effects, and people can weigh the risk and the benefits. But like, if you're gonna deny altogether that there's an impact of vaccination side effects on mortality, yeah, then people are not gonna believe you. That's why I do this research. I mean, if the government was open and honest about it and show the data and say like, yeah, decide for yourself, that's then they would have credibility. But now they have, yeah, they lost their credibility basically. I gotta do the research myself. Anyway, back to New Zealand. So no, sorry, to South Africa. um, so there you can, with only the third of the population vaccinated, that's a much smaller impact, and the death rates has increased quite significantly, 34%. Um, and I'm sure I don't see the birth rate here on this particular window, but like I'm sure. I mean, if in New Zealand the death rate had been 34% higher than the year before, still the birth rate is higher than the death rate. So even 34%, it's 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 very significant, but it's not that. Also, South Africa is not demographically threatened or anything. So, um, but yeah, in South Africa, it could very well be related. I would say it's most likely related to COVID deaths. Um, and whether they would have been preventable by vaccinations or by early treatment. That's a completely different discussion. But yeah, it's um, given these numbers, I can only conclude in South Africa the significant increase in deaths is caused by COVID. And again, not the end of the world, but we given if you put all these data together, you should realize that COVID has an impact. If you just let COVID run wild on anyone without early treatment or late or proper late treatment even, and no vaccination, it will have a significant impact in death rate. But vaccination itself, there's a price for that as well. So, long story short, it's an individual choice. I mean, the side effects are much more equally distributed amongst different ages, whereas the chance of dying from COVID is hugely more happening, is hugely greater in the older people and the more fragile people. So um, if you're old and you don't want to get vaccinated, what's your plan? I hope you have alternative treatments, because like I definitely wouldn't want to go with remdesivir, for example. If you're especially if you're in the US, I guess it's still around. Um, uh, you can get your hands on stuff that is maybe not officially allowed. I don't know. That's up to you. But like, to think that you're not gonna get COVID is completely naive. You are gonna get COVID. And of course, the statistics I show here is from 2021, which is mainly Delta and Beta in South Africa. So in 2022, the impact will be much smaller because Omicron is much more benign, much less deadly. So the figures in 2022 will be less impacted by COVID, but the vaccination shot is still the same one, right? It's still the same from last year. That's not going to change. So if you're young and healthy, do you want to take the risk of getting COVID shots every however many months. Uh, it's a different choice than for old people, right? I mean, if you're old and you're not going to do anything about it, a bit naive. But if you're young, and especially if you got it already, I mean, you're gonna get it sooner or later, vaccinated or not. So once you've had it, what is the benefit of an extra shot? What's the benefit of keeping on going? There's no data for that. Um, anyway, that's it for this week. Good luck making your own choice, and see you next week.